So hello, I am Erica. I am the owner of Love Reigns Medical Training Center in Gainesville, Florida. I am a registered nurse, been in the medical field my entire adult life. And I want to come in today and talk about how can we avoid med errors during our med pass, okay? I'm specifically gearing this toward Medtechs and assisted living facilities, but this should apply to most people who would be assisting people with medication. So let's talk about how to avoid those things. Let's talk about how often med errors happen. So before I get started, I just want to know in my business I do teach certified Medtech. I also teach Medtechs for people with disabilities. Lots of experience. I worked as a director in assisted living for over 5 years. I also teach medical assistant training, phlebotomy training, CPR, first aid. So all my background is in the medical field, and would say I would be an expert on these things. But so I want to just kind of see how I can help you guys out there if you are facing challenges with passing your medications and how to avoid making those mistakes. And believe it or not, it happens more frequently than we even know about, okay? And it's not just med techs that make these med errors. Believe it or not, there are nurses also. So I am in the state of Florida. So my all the education I'm going to give you here will be geared for the state of Florida. Okay, so understand that worldwide mistakes happen. Worldwide, the basics of how to avoid those mistakes are standard, but I want to make sure that it's clear that I'm coming to you from an education point of state of Florida. Okay, so let's talk about it. Let's talk about some things. So I want to tell you really quick about more people die in a given year as a result of medical errors than from motor vehicle accidents, okay? Breast cancer, AIDS, medication errors alone. That is a huge number of med errors. And there are times, even as myself, that I have made a med error. So it happens more often, and it's, and we are humans, so errors happen, okay? But what we want to do is figure out the best way to avoid making those mistakes going forward. So that's kind of what I want to talk to you about, some things, and specifically medtech. So medtechs in assisted living facilities. The requirement for you to become a medtech in those settings is a 6-hour course. And then the family members or the guardian sign what's called an informed consent, saying I'm okay that you're not a nurse and that you've taken a 6-hour training and that you are going to be assisting my loved one with medications. So that's what I do primarily every day or whenever I have classes. So let's talk about how to avoid making med errors. So first thing first is they have what's called the 9 rights, okay, of medication. So let me talk to you about that. Let me pull that up. Okay, so I have here in front of me the 9 rights of medication administration in an ALF, okay? So let's talk about the 9 rights. These are things that are put in place, the state of Florida have put in place. So these are things that protect you and to keep you from making mistakes. If you follow these 9 rights, you will not make a med error. But the problem is a lot of us skip steps that we shouldn't skip. So let's talk about what you should do and how to hopefully keep your loved one, your residents, your patients, whoever that you are assisting with meds safe, okay? And keep yourself out of trouble, because that's the ultimate goal, is to keep yourself out of trouble and to not harm anybody. So first, there are 9 rights. The first one, right resident. You want to make sure you know the resident, identify the resident every time, okay? That's a problem, because sometimes we leave out of the room or we walk away and we come back and we're supposed to identify that patient again, okay? So you want to identify the resident, and they are called residents in assisted living, every time, and confirm by name, date of birth, a picture on the MOR, a medication observation record is a MOR. And so you should have, in most facilities, should have a colored picture of the resident. And let me just grab my MOR for you real quick. So when they are referring to a MOR, M-O-R, medication observation record, because in the state of Florida, a medtech can assist meds by observation, okay? They cannot administer meds. Only a nurse can give meds by administration. So a nurse will be using a MAR. A medtech will be using a MOR. So this is a medication observation record. This is pretty much what you would use to assist your resident with meds. But what I want to show you is that every resident should have a color, and these aren't real people, just be clear, okay? This is just simulated from my trainings. But this says you should have a colored picture of the person that you're going to be assisting with meds, with their name and everything. So you still are going to ask them their name and all that, but and just in case they couldn't tell you, your facility should have in each of your MORs a colored picture, and we want it in color, so that way we can make sure that who I am assisting with meds is who I'm looking at on this picture, okay? So that's super important that you understand that, okay? So you want to make sure that with permission, of course, the picture should be with permission, okay? And that usually is done on admission. Okay, so that is the right resident. That is the first of the 9 rights. Number 2, the right medications. I'm telling you, these are things, if you do these steps, you will not make a med error, okay? Now, understand that we are human. It can happen, but these are things put in place to help protect you. Right medication. You want to check the medication label and order 3 times. So literally, you want to go from the MOR to the med, back and forth, verifying the med matches the label on so the MOR, which is the medication observation record. Let me just show you what I mean when I say MOR, you guys. So I want to make sure you understand, especially if you're brand new or just looking to go into the field and you're not sure. And I haven't heard some of these names. This is a medication observation record right here, okay? This is a MOR. Now, I teach the group home version of it too. So that's why you see MOR on this. But for assisted living, it would be called a MOR. But for the most part, these are all the residents' medications, the times of the meds. These are the boxes that you sign off that you gave the med. This is where you'll put your name once a month so they can know who these people initials are. And then you'll go on the back end document as well. But a medication record is proof that you gave the medication. That is a way for you to verify that the medication on the label of the med matches here. It should match 100%, okay? So that is a MOR, okay? And each resident will have their own MOR, okay? So again, right medication. You want to check the medication label and order 3 times. And that's all they're saying is that I'm looking at the card of meds and I'm looking at the MOR. I'm looking at the MOR, I'm looking at the meds. 3 times. That way you make sure that what you saw is what you saw, okay? And then you're gonna check the MOR, check the label, then check the MOR with label. Read the label to the resident and verify the resident understands the drug dosage and reason for use. So you're supposed to let the resident know. So that means on top of everything, you should be pulling these medications with your resident sitting right there with you. Understand that sometimes what you see in reality is not accurate. When I teach my course, I tell people the correct way to do this. They take on a whole another route when they get into these places and see what goes on in some of these places. I'm telling you, this is why mistakes happen. Don't follow the crowd. They have policies and procedures in place. If you follow them, you will do well. So again, right medication. You want to check the medication label against the MOR 3 times. I'm just looking back and forth to make sure that everything on this label is matching what it says on the MOR, okay? And then you want to read the label to the resident and verify. And the meds should be pulled with your resident sitting in front of you, okay? We do not put meds in cups and take them to the room to the resident already prepared. That is not your role. The reason why you're able to assist with meds is because you have to follow certain policies. One of them is that resident should be present when you're pulling their meds because you're only assisting them with. Okay, it's a lot, so I'm going to try to speed this up a little bit. The next route, the next 9 rights I've covered 2. The third one is the right dosage. So on top of you verifying your meds, looking back and forth, you're also going to verify that you're getting the right dosage, okay? Sometimes if you move too quickly, you can pull the wrong dose of meds. It could be a 250 in the cart and a 500 in the cart. You just moving quickly, you will grab the wrong dose. So you want to make sure that you have the right resident, the right medication, and the right dose. That is super important that you pull the right dose. Check the dosage amount, triple check the label with the MOR so you can avoid a mistake. Number 4, the right time. I told you on the MOR, the times are listed there. If you're working day shift and you have 10 a.m. meds and you give a 10 p.m. med, that is a med error. That is a mistake. So you need to make sure that you're only looking for the meds that are scheduled during your shift, okay? I'm just saying, if you work night shift, you want to be looking for the meds that are scheduled on your shift. So the right time. Check the time. Medications must be given at the time prescribed. So if the orders is for 10 o'clock in the morning, you can start as early as an hour before and you must be done an hour after. So 9 a.m. to 11 a.m. you should be done with your meds. There's a 2-hour window. So So check the time. Medication must be given at the time prescribed. Standard practice is that medications are given within 1 hour before or 1 hour after the time noted. Understand that sometimes emergencies happen. You might have to send a resident out. You could have been late to work. Whatever the reason is, that time frame may get pushed, but the state of Florida says you're supposed to be within that time frame. On occasion, you may run over, but it's your goal to try to stay within compliance of that time, okay? Next is the right route. The right route meaning the way the medication goes into the body. That's one of the routes. So you don't want to put eardrops in eyes. You need to make sure that whatever the order says, that you give it the correct way. If it says give the medication by mouth, you would put it in their mouth. Check the route. Confirm that the patient can take or receive the medication by this route. We want to make sure that it's appropriate for that resident. Oral by mouth, topical, ointments, or patches. If it's a patch, if it's a transdermal, meaning patch on the skin. You want to make sure that wherever the med is supposed to go, that you correctly do that. Okay? Unlicensed staff are not allowed to assist with injectable, urethral, vaginal, or rectal meds. That is a no-no. It is in bold writing on purpose here, okay? They want to make sure you know that you are an unlicensed staff, which is a Medtech because you're not licensed. Only nurses are licensed, okay? Are not allowed to assist with injectables, nothing by injection, no needles, okay? No urethral, meaning you're not putting anything in the urine route where you pee from, okay? You're not putting anything in the vaginal route. You're not putting anything in the rectal route. That is for a nurse. That is all considered administration of meds. That is not you. You cannot assist with that, okay? Right documentation. Okay, next up is right documentation. This is your one big, huge job. If you don't do nothing else, documentation is super important. That is the only way they can verify that you gave the medication and you did your job. So let's read it. Right documentation. Properly document each dose offered on the medication observation record. Document administration, and the key word is after giving the ordered medication. I see people all the time signing as they go. You're supposed to give that sign for that medication after they have swallowed the medication, okay? Chart the time, the route, and any other specific information as necessary, including refusals. If your patient refuses that med, that more I showed you, you have to go on, you're going to circle your initials first, because you're going to initial every time you give a med. But if they don't take it today, you're going to circle your initial, and you're going to go on the back and document. Okay, that's all I'm saying. So make sure that you are documenting. That's why you're not supposed to document at the end of your shift. People go and get the MAR and do all their documentation before they leave. How can you verify that you gave that person that med? There's too many meds. There's no way you can verify for sure that you pulled each of those meds and gave it if you're pulling them by memory and not going down the list with the MAR, with the medication, with the resident present. This is why they put these things in place, so you can avoid hurting a patient. You know how many people have died because we have made mistakes, giving meds, rushing, not following the policy. I'm telling you, you make decisions on your own to do the opposite of what we teach you. But if you do it correctly, you will never hurt a patient, okay? Next one is right response. Make sure that the drug led to the desired effect. If an antacid was given, so something for like upset stomach was given, for heartburn, was the heartburn relieved? So we really need to document, I gave them Tylenol, they complained of a headache, I gave them Tylenol, I came back and follow up to see did the Tylenol work. Because what we do is give people medicine over and over. I give them Tylenol every day, and it didn't do anything for them. So does the patient verbalize improvement in depression or whatever med we're giving them? Are they saying they feel better? Are they still complaining about whatever the issue is? Because if it's not working, we need to change that, okay? Right reason. Confirm the rationale for the ordered meds. What is the resident's history? Why is she taking the medication? So on the MAR, when you're doing the medications, and some people are electronic, understand that it may be an electronic MAR, but all the stuff still applies. But on the MAR, and you may not can see this as well, but here on the first one, I'm just going to tell you, this says Cystex. That's for you, and it says Cystex, take 1 tab by mouth twice daily for urinary pain. So it has to be in words that you understand, not medical terms like PO, BID, things you never heard of. That's medical stuff for nurses. But it has to say layman's words. So take 1 tab by mouth twice daily for urinary pain. It has to say. So you're supposed to tell the resident why you're giving them the medication. So the people that make your MARs up should have on there the reason for the med, the doctor who wrote it, and the date it was written. That is a completed order on the MOR, and that tells you everything you need to know, and especially if you have to call it to follow up on a medication, we know who wrote the order. But the most important part is that the resident, do you want to know what you're taking? Yes, I want to know. What is Cystex for? I never heard of that. That is for urinary pain. You just literally read it from the MOR, okay? So it's important that those things are listed on the MOR. If you get your MOR and that stuff is not listed, you need to go notify your supervisor. I don't know what this med is for. The resident's asking me what it is, and I don't know. So that's really, and most people know this. I'm just telling you that it needs to be listed on the MOR, okay? So that is the right reason. Confirm the rationale for the order med. And the last one is the right to refuse, okay? Let's talk about that. A resident has a right to refuse a med by Florida law. A resident may not be compelled, forced to take the medication, nor may you hide medication in their food or drink. Check the frequency of the ordered medication. Double check that you are giving the order dose at the correct time. Those are the 9 rights. Those are the things that's going to keep you from making med errors. Signing your meds out as you go. I didn't cover narcotics. I have a separate video already out on narcotics, but I want you to know also with narcotics, there's a lot of errors made because we are pulling narcotics and giving them without signing for them at that time. You need to sign out your narcotic. If you give a control med, sign for it right then. That way your account will never be will be incorrect. Never take the keys from somebody who didn't count with you. Because if that count is incorrect and the state walk in or the director come and ask you to count, that is going to be on you as the Medtech because you took possession of the keys without counting. You're not supposed to do that. On that control sheet, there's 2 spaces. One is for staff on and staff off. So that means that we verified that there was 10 oxycodone left on that card. So hopefully these things have been helpful for you. I'm just trying to get you to keep you from making med errors. And I also want you to know that distractions also increase med errors, okay? So these things will help you, but using your phone, talking to people about what happened last night, anything that could distract you. Also, when you're doing meds, one person at a time. These people are going to come back from wherever they're coming from, piling up around you. Don't let them intimidate you. Don't let them make you nervous. You need to make sure you're able to focus on one person at a time. So you just want to make sure that even if you're in an open area somewhere, that you provide as much privacy as you can and focus on that one resident. These are the things that will help you avoid med errors. I hope this has been helpful. If you have any questions, please list them below. I'll talk to y'all later. Thank you.